Desperate times call for desperate measures. This is especially true for many of us in healthcare, as we find ourselves adapting to new roles and new units, innovating to tackle a new disease while adjusting to a new surreal reality. Hence, in an effort to re-establish some degree of normalcy, we decided to resume the release of our episodes on the Neurocritical Care Society podcast. As I say, the show must go on, and at least now you can listen to something that is non-COVID related for the next 20 minutes. I hope you enjoy this episode. Hey NCS podcast listeners, this is your host Fawaz Al-Mufti from Westchester Medical Center. With the rapid evolution of neurocritical care, better comprehension of acute brain injury, as well as the relatively rapid influx of new medications, today more than ever, neurointensivists find themselves engaging and partnering with critical care pharmacists. From sedatives, hyperosmolar agents, vasopressors, or more specifically anti-epileptic agents, neurostimulants, or reversal agents, the pharmacotherapy of acute cerebral injury is undoubtedly complex and multifaceted. Hence, the NCS podcast decided to partner with the highly successful Pharmacotherapy of Neurocritical Care series, the PONS, in a limited release to cover pertinent pharmacologic topics presented by experts in the field of neurocritical care. Over the course of the coming months, you will hear a number of selected PONS talks, but please do let us know if there are particular topics you would like to be additionally covered. Without further ado, here is the PONS.
Hello everyone, and welcome to the Neurocritical Care Society podcast. I am Jeffrey McSavage, co-chair of the Pharmacotherapy of Neurocritical Care Series, or PONS subcommittee. For this podcast, we will be wading in the weeds, so to speak, exploring the medicinal use of cannabinoids and issues with their use in the neurocritical care population. It is a pleasure today to have Dr. Ken Owusu, a clinical redesign consultant at Yale New Haven Health, on the podcast. Dr. Owusu is involved in clinical research with cannabinoids. He also has experience working in Connecticut dispensaries and is published in the field. In addition, he co-authored the PONS presentation on this topic, which is published on the Neurocritical Care website and available for CE or free to members for educational use. Dr. Owusu, welcome to the show.
Thank you, Jeff. It's a pleasure to work with you guys on this.
Dr. Owusu and I met a few years back at an NCS meeting, and it really is an honor to have the opportunity to interview you now and to learn from your experience. Kent, I don't know if I ever told you this story, but I got interested in this topic a few years ago when I was attending a backyard barbecue of a friend and met some new people. We got to talking about work, etc., and of course it comes out that I'm a neurocritical care pharmacist, and the guy I'm speaking to replies, "This is great," shows me his craniotomy scar and says, "Do you think medicinal cannabis can treat my tumor?" At the time, I was at a complete loss of words, but it really made me think that many healthcare professionals are getting these types of questions, and most professions have never really had any formal training on the topic. From the research that I've done, it appears that cannabis really had a long history medicinally in human culture, but where are we at with it today in the United States?
Thank you, Jeff. And I think it's interesting, the story you shared, because it's quite apparent that there's a lack of awareness or at least clinical competency when it comes to cannabinoids specifically and applications in healthcare. There's been several advances, both pharmacologic and cultural, throughout the previous decades related to cannabinoid use, and there's been influences in the medical setting related to that. So since California passed a Compassionate Care Act several decades ago, many states have followed suit. So to date, currently, there's about 33 states and the District of Columbia who have legalized cannabinoids for medicinal purposes. Although characterizing the total number of users is a bit challenging because there's some variability in the requirements for registration and how to keep track of all of that stuff. So it's been estimated that about the number of people who are using cannabinoids for medicinal purposes, it's about 2 to 3 million in this country. I should also add that there's a variability in the data in terms of what folks are using medicinal cannabinoids for. So for instance, most people report using it for chronic pain. That's about 60% of the surveyed patients who are using cannabinoids for medicinal purposes. And next to that is multiple sclerosis, including spasticity symptoms, and then cancer-related chemotherapy and nausea and vomiting. There's some data that suggests that there is some benefit in patients who've experienced post-traumatic stress disorder and overall cancer. Generally, these data point to the fact that patients are really seeking alternative treatments and that there may be implications when used in combination with conventional therapies. So that's where we are today in this country.
Well, interesting, and that really goes back to the question that I got asked. And then my next question is about, there's a lot of surveys that I've read of pharmacists and physicians basically summarizing that we as healthcare professionals are not comfortable with these products. We didn't learn about them in school. This is changing now. Some schools have implemented them into their programs, pharmacy and in some medical programs, but the majority of healthcare professionals out there practicing really don't know much about it. What do clinicians need to know about the pharmacology of these compounds?
Yeah, you're exactly right, Jeff. Most clinicians don't feel comfortable and frankly don't know how to approach dealing with patients who are prescribed cannabinoids for medicinal and or recreational purposes. There are several conditions or considerations, including drug-drug interactions and toxicities, and then there's some regulatory issues related to using cannabinoids for medicinal and or recreational purposes. Additionally, there's several receptor targets that clinicians may be likely need to be familiar with, and they may want to know when their patients are prescribed cannabinoids for medicinal purposes. Because there's a lack of federal regulation of things like packaging of edibles, clinicians should also consider that there is a potential for inadvertent ingestion of edibles, for instance, when pediatric patients present, and there's a history that's really unclear. But with increasing availability of cannabinoids to patients, Jeff, it's really important that clinicians need to be aware of potential toxicities as well, both associated with acute and chronic cannabinoid exposure. At this current time, there is a lack of quality evidence regarding the safe use of the various strains and preparations of cannabinoids. So it is very important that we as clinicians really get familiar with how patients present when they're using cannabinoids, but also how using cannabinoids affect the care that we provide to our patients.
I know you mentioned overdosing and the toxicology part of it and the issue with the edibles and pediatrics. So how are these products dosed, and can you just describe a little bit about the way they're administered?
Yeah, I can touch on briefly about various methods to really administer cannabinoid preparations. Some of the most common methods of administration of cannabinoids are through inhalation directly by smoking, vaporization, or ingestion as well of the edible products, as I mentioned earlier. Based on these methods, the way the drug passes through the body and the pharmacokinetics is somewhat variable. So, for example, when cannabinoids are inhaled, it leads to absorption of approximately 25 to 50% of the product that's inhaled through the lungs into the bloodstream, and then it gets to the brain within minutes. It peaks within 30 minutes or so when it's used via this route. While smoking is the most common form of cannabis administration, vaporization also provides a similar effect to smoking, and it provides less exposure to combustion and carcinogenic byproducts. When you give the same amount of inhaled cannabinoids enterally, so by just taking it by mouth and then having it go through your stomach, the blood concentrations are generally 30% less than those that you get when you take the inhalation, and this is because it gets broken down by first pass through the liver. So those are some common methods of administration of cannabinoids, and based on the route, the effects are going to be highly variable.
So the big money question, though, I have to ask is, where is the data? You know, practitioners want to learn more about these drugs, learn more about these compounds. What conditions have the best data, and where will our listeners be encountering these products being used?
Yeah, Jeff, that's a great question, and it's one that we continue to explore as more data becomes available. So because there hasn't been a huge focus from a federal standpoint, and also research focuses with respect to cannabinoids, since it's currently to date federally illegal, it has been somewhat difficult to get quality evidence supporting the use of cannabinoids for medicinal purposes. So most of the data we have is not great, but we do have some data to work with. You may recall that most recently cannabidiol or Epidiolex was approved for refractory epilepsy, so that is the best evidence we have to date with respect to cannabidiol. It is important to note that a lot of the data we have with medicinal cannabinoid use surrounds indications such as multiple sclerosis and central pain, where we think it's probably effective when you administer cannabinoids via the oral route with the extracts. There are other indications associated with symptomatic neurological disorders, so patients who present with urinary dysfunction, there is some data that suggests that when you use the synthetic forms, it's probably effective. However, most of the data has not been promising for this indication. And then there's been some studies that have looked at the application of cannabinoids for disorders like tremors. Again, there's not good quality evidence, but what the data currently shows for that indication, it's likely ineffective and therefore should not be used for that indication. So the data mostly applies to conditions like multiple sclerosis and central pain, and then epilepsy being the most recent approved product, cannabidiol, for that indication.
And then just in so a lot of these indications are really left on a state-by-state basis, what state legislatures approve for a particular indication. Is that not true?
That is true. So, for instance, in Connecticut, cannabidiol or THC can be prescribed for specific indications that are approved by the state. So, for a patient to qualify for legitimate medicinal use, they have to be certified under one of the over 40 approved indications. When you move from Connecticut to New York, there is a different list to consider for certification for medicinal purposes. So you're exactly correct that the certification is based on the indication, and there is variability based on which state you're referring to.
Really, really complicated when you're trying to sometimes care for patients, especially if you live close to a bordering states where patients transfer from different states for care, which happens a lot in Chicago. But what really is the future? Where do you see this whole cannabinoid story going?
Yeah, so the future is promising, right? So we do have some challenges. So currently there are discordant federal and state regulations, as you highlighted throughout the discussion. When you look at the DEA scheduling and classification, and there's inconsistencies there. There are state laws that specify patient qualifications and access with different restrictions based on the states that you're looking for. So what applies here in Connecticut would not apply in other states, as you have highlighted before. It is unlikely that prosecution in states with legalized medicinal and recreational use may occur, but that's something that clinicians or patients are thinking about, right? Because federally, there is no appropriate use for cannabinoids for medicinal purposes. That is a concern that most patients or clinicians have when it comes to that. We find that families are relocating to states with legalized use even before cannabidiol was approved for epilepsy. We knew that there was a huge unmet need in children, pediatric children who had seizure disorders. So families would travel across state lines to get the medicinal attention to help with the lack of improvement in the patient's symptoms, their kids. We also talked about different inconsistencies with respect to the regulations. So because there is lack of federal funding, a lot of these products are highly unregulated based on which state that you are looking at. So that's an opportunity for future. It is promising, however, that there's increase in evidence of efficacy and safety. For instance, the most recently Epidiolex, the indication of epilepsy. So that is something that seems promising to me. It is important to note that with the increase in evidence available, professional organizations need to really look at the right approach to then endorse and provide appropriate clinical support so that when clinicians are faced with decisions to certify patients, they feel like they have that professional support as well. So just in summary, the use of cannabinoids for these medicinal purposes we know is increasing because patients and caregivers are seeking assistance to treat and improve symptoms for several neurologic conditions that are refractory to available pharmacotherapy that is currently present. The evidence supporting its use is variable, as we highlighted, and quality evidence associated with toxicities is lacking. So we know that there remains an unmet need for further research and education for clinicians who care for these patients exposed to cannabinoids use. So I'll leave it at that. The future is bright, and I am hopeful that we get to learn more about the applications of cannabinoids in our neuroscience patient populations.
Well, stay tuned. This is definitely a topic that is constantly changing, and there's new information out there and regulation-wise and state-wise all the time on it. Dr. Russo, I just want to thank you again for shedding more light on this topic. I know I learned something today, and I'm sure our listeners did as well.
It was a pleasure having this chat with you to get this information out there to our listeners. So we look forward to learning more about this and seeing what the future holds.
Thank you so much. It is an exciting topic, and I'm just happy that more and more healthcare professionals are getting out there and seeking the information, and programs like this can get the information out there to them. If you like this podcast, please check out our other podcasts offered by the Neurocritical Care Society. Also, a full educational presentation on this topic and other drug-related topics can be found on the Neurocritical Care website under the PONS section. PONS is your neurocritical care pharmacotherapy information resource taught by the experts in the field. All PONS programs are eligible for CME for purchase and free to society members for educational purposes. Thanks again for listening.
The NCS podcast series is produced by the Neurocritical Care Society, whose mission is to promote quality patient care, professional collaboration, research, training, and advocacy in neurocritical care. Our production staff includes Fawaz Al-Mufti, Lamani Baloo, Mike Brogan, Josh Levine, Benjamin Miller, Sterain Shepard, Jim Siegler, Sarah Sternnezer, and Chris Zamet. Our senior producer is Bonnie Rousseau. Our administrative staff includes Bonnie Rousseau and Angel Gindel. Music is created by Mohan Kadapali from the Division of Neurocritical Care at the University of Miami. The NCS podcast series is available on NCS On Demand and wherever you may listen to your podcast. For more information, please follow us on Twitter @Neurocritical or on Facebook. I'm Fawaz Al-Mufti and thanks for listening.